The first surgery we're going to talk about is the most complicated of the three, the gastric bypass. Gastric bypass has historically been considered the gold standard surgery to which we would compare any other surgeries, whether old or new. I'm not so sure that I've ever been a big fan of that point of view, but there is no question when you look at the various treatment strategies in trying to design a surgery, gastric bypass is a very effective surgical tool. It basically works via three mechanisms. The first is, and it's not important to understand all of the anatomic stuff and basically be a surgeon about this stuff. The principles are simple, and that's what's important. And the first principle is we create a tiny stomach. Now, the typical gastric bypass patient early after their surgery has a 2, 3, maybe 4-ounce portion size. Over time, over the course of the next year to 18 months, that portion size typically grows to about 6 to 8 ounces, but still significantly less than what you're used to eating. So reduced portion size, restriction, which is one of the fundamental principles of all of the surgeries that I offer. The second principle of gastric bypass, because we're reorganizing your small intestine, rerouting, if you will, short-circuiting, in a sense, your small intestine, that creates a thing called malabsorption. Your small intestine is the part of your GI tract that absorbs all the food, the energy from the food that you eat, the calories, if you will. When we short-circuit it, it reduces your body's ability to absorb some of that energy, and it just passes on out with your stool. And then the third mechanism by which gastric bypass works is sort of a behavior modification. The rerouting of the small intestine, and probably in combination with the small stomach, can create a scenario called the dumping syndrome, which typically occurs when somebody eats either a small amount or it can be a fairly large amount of regular sugar, table sugar, sucrose, or it can even happen with really concentrated fats. But the dumping syndrome is breaking out in a cold sweat, getting nauseated, realize that you're about to throw up what you just ate, maybe have some explosive diarrhea, and want to pass out, and then if it's really bad, feel like you're going to die. But other than that, it's not too bad, right? It can be a profound behavior modifying threat, if you will. It's the big stick. It's the negative reinforcement. And these are the three things that make gastric bypass a very powerful weight loss surgery tool. Now, I'm going to be honest with you. In my armamentarium, the lap band, the sleeve gastrectomy, and the gastric bypass, I honestly, in this day and age, see gastric bypass as a second-tier surgery. It would not be the first surgery I would think about doing. Outside of, and this debate is still raging, unless I was a severe diabetic. There's still some strongly held opinion that gastric bypass is the definitive surgery for diabetes. But when you look at the long-term studies, the only thing that correlates with resolution of the diabetes really strongly is how well you sustain your weight loss, not which surgery you have. But put that aside for a second. The reason I consider gastric bypass sort of a second surgery tool has nothing to do with its power as a weight loss surgical tool. It has to do with just the attributes of gastric bypass. Because it is such a complicated surgery, to me, gastric bypass is like bringing a sledgehammer to a picture hanging competition. It's not the first tool I would pick out of the box of hammers to put that little picture up on the wall. It's way more than I need, and if I'm not real careful in how I handle it, I can create some unintended and undesired consequences. And that's my issue with gastric bypass, is even if you do everything exactly right, follow every instruction to the letter, you can end up with some unintended and undesired consequences, like ulcers, like strictures, like adhesive disease that can cause bowel obstruction, like internal hernias. There are even some people in extreme cases get a profound low blood sugar if they don't eat exactly right. Again, these are rare. I don't want to say they're rare as hen's teeth, but they're uncommon. But if you're that one that has them, it can be problematic. And I've even had a handful of gastric bypass patients through the years who ultimately elected to have their gastric bypass reversed because of these totally unrelated but unintended and undesired consequences. So again, gastric bypass, very powerful weight loss surgical tool. May be the definitive weight loss surgery for somebody with severe brittle diabetes, but has issues with unintended consequences. When you think it through, think about all of those things. And if I've raised any additional questions that I haven't answered here, obviously ask me when you see me in the office.